Question 1. A nurse is preparing to administer medication through a nasogastric (NG) tube. What is the most important initial nursing action to ensure patient safety? A. Crush all medications into a fine powder. B. Mix all medications together in one syringe. C. Verify tube placement before administration. D. Position the patient in a supine position. Answer: C. Verify tube placement before administration. This question tests the essential safety principle of medication administration via an NG tube. The keyword most important initial action emphasizes that patient safety takes precedence. Verifying tube placement is crucial to prevent aspirating medication into the lungs, which could lead to severe complications like pneumonia. For instance, before giving any medicine, the nurse should check the pH of aspirate, auscultate air insufflation, or confirm with an X-ray if the tube was just inserted. Always remember that ensuring the medication goes to the correct place is the first step in safe delivery. Question 2. A nurse is caring for a patient who reports excruciating pain after surgery. What is the most appropriate initial action for the nurse to take? A. Document the pain in the patient's chart. B. Offer the patient a warm blanket. C. Administer prescribed pain medication. D. Reassess the patient's vital signs. Answer: C. Administer prescribed pain medication. This question focuses on effective pain management, which is a fundamental nursing responsibility. The phrase "most appropriate initial action" indicates the need for a direct and effective intervention for acute pain. When a patient reports severe pain, the priority is to alleviate their discomfort by administering the ordered analgesic, assuming there are no contraindications. For example, if a patient has a standing order for a pain reliever, the nurse should give it promptly rather than just documenting or providing comfort measures that do not directly address the pain. Remember to act on pain reports quickly to promote comfort and healing. Question 3. A nurse is educating a patient about preventing falls at home. Which statement made by the patient indicates a need for further teaching? A. I will keep my pathways clear of clutter. B. I will use throw rugs to make my floors look nicer. C. I will make sure my home is well lit. D. I will use grab bars in my bathroom. Answer: B. I will use throw rugs to make my floors look nicer. This question addresses fall prevention, a critical safety topic in nursing fundamentals. The keyword phrase indicates a need for further teaching, signals that the nurse is looking for an incorrect or unsafe statement. Throw rugs are a common tripping hazard, especially for older adults or those with mobility issues, and should be avoided or secured to prevent falls. For instance, if a patient uses throw rugs, they can easily slip or catch their foot, leading to a fall. Always emphasize removing tripping hazards like loose rugs to create a safer home environment. Question 4. A nurse is preparing to insert an indwelling urinary catheter for a female patient. Which principle of aseptic technique is most important to adhere to during this procedure? A. Washing hands after the procedure. B. Donning sterile gloves before touching the catheter. C. Explaining the procedure to the patient. D. Placing the drainage bag above the bladder level. Answer: B. Donning sterile gloves before touching the catheter. This question assesses knowledge of aseptic technique, specifically for sterile procedures like catheterization. The keyword most important to adhere to points to the core principle of preventing infection. Using sterile gloves ensures that microorganisms from the nurse's hands are not introduced into the patient's urinary tract, which is a sterile body cavity. For example, failing to use sterile gloves significantly increases the risk of a urinary tract infection, UTI, a common healthcare-associated infection. Always remember that maintaining a sterile field and using sterile equipment are paramount during invasive procedures to protect the patient from infection. Question 5. A nurse is assessing a patient's radial pulse. Which finding requires immediate further investigation? A. Pulse rate of 72 beats per minute, BPM. B. Pulse described as strong and regular. C. Pulse rate of 48 BPM. D. Pulse strength 2+. Answer: C. Pulse rate of 48 BPM. This question tests the nurse's ability to interpret vital signs and identify abnormal findings that require intervention. The phrase "requires immediate further investigation" indicates a potentially critical deviation from normal. A pulse rate of 48 BPM is considered bradycardia, which is significantly lower than the normal adult range, typically 60 to 100 BPM, and could indicate an underlying cardiac issue or other serious condition needing prompt evaluation. For instance, a patient with a very slow pulse might experience dizziness or decreased organ perfusion, necessitating quick assessment. Always remember to prioritize abnormal vital signs, especially those outside the critical normal ranges. Question 6. A nurse is caring for a patient who has a new prescription for a clear liquid diet. Which food item is appropriate for the nurse to offer the patient? A. Cream of tomato soup. B. Gelatin. C. Orange juice with pulp. D. Milk. Answer: B. Gelatin. This question evaluates the nurse's understanding of therapeutic diets, specifically a clear liquid diet. A clear liquid diet includes foods that are transparent and liquid at room temperature, providing minimal residue. Gelatin fits this description because it is clear and dissolves in the mouth, unlike milk, pulpy juices, or creamy soups, which are not considered clear liquids. For example, after surgery, a patient might start with gelatin, broth, or apple juice to gradually reintroduce nutrition without irritating the gastrointestinal tract. Always remember that clear liquids are designed to be easily digestible and leave little to no residue. Question 7. A nurse is assessing a patient with a surgical incision. Which finding indicates a potential wound infection? A. Serous drainage. B. Pink, healthy granulation tissue. C. Warmth and redness around the incision. D. Staples intact. Answer: C. Warmth and redness around the incision. This question focuses on wound assessment and recognizing signs of infection. The phrase indicates a potential wound infection prompts the identification of inflammatory responses. Warmth and redness, erythema, around an incision are classic signs of inflammation and infection, as the body's immune response increases blood flow to the area. For instance, if a patient's incision site feels hot to the touch and looks bright red, it's a strong indicator that microorganisms may be present, requiring further assessment like checking for purulent drainage or fever. Always be vigilant for signs of localized infections such as increased heat, redness, swelling, and pain around a wound. Question 8. A nurse is documenting an incident where a patient fell out of bed. Which information should the nurse include in the incident report? A. Speculation about why the fall occurred. B. The nurse's personal feelings about the event. C. Factual, objective description of the event. D. Blame assigned to the patient or staff. Answer: C. Factual, objective description of the event. This question tests the principles of professional documentation, especially regarding incident reports. The core concept is objective reporting. An incident report should always contain only factual, objective information, describing what was observed and what actions were taken, without speculation, personal feelings, or assigning blame. For example, the nurse should document patient found on floor beside bed rather than patient carelessly climbed out of bed. Always remember that incident reports are legal documents focused on facts to identify risks and improve patient safety, not for assigning fault. Question 9. A nurse is teaching a patient how to use an incentive spirometer. Which instruction is most important for the nurse to include? A. Exhale slowly and deeply into the mouthpiece. B. Hold your breath for 3 to 5 seconds after inhaling deeply. C. Use the spirometer every 4 hours while awake. D. Lie flat in bed when using the device. Answer: B. Hold your breath for 3 to 5 seconds after inhaling deeply. This question focuses on the correct technique for using an incentive spirometer, a common respiratory intervention. The keyword "most important" emphasizes the crucial step for effective lung expansion. Holding the breath after a deep inhalation allows the alveoli, which are tiny air sacs in the lungs, to expand fully and gas exchange to occur more effectively, preventing atelectasis, lung collapse. For instance, if a patient inhales and immediately exhales, the lungs don't get sufficient time to expand properly. Always remind patients that the hold at the peak of inspiration is key to maximizing the benefits of incentive spirometry. Question 10. A patient is prescribed a medication that needs to be given PRN. What does this abbreviation mean regarding medication administration? A. Administer only in the morning. B. Administer as needed. C. Administer by mouth. D. Administer after meals. Answer: B. Administer as needed. This question tests the nurse's knowledge of common medical abbreviations used in medication orders. Understanding PRN is fundamental for safe and effective medication administration. PRN is an abbreviation for the Latin phrase pro re nata, meaning as needed. This indicates that the medication should be given when the patient exhibits a specific symptom or condition, such as pain or nausea, rather than on a fixed schedule. For example, a pain medication ordered PRN means the nurse assesses the patient's pain level and administers the drug only if needed and within the prescribed frequency. Always know your abbreviations to prevent medication errors and ensure patient safety. Question 11. A nurse is assessing a patient for dehydration. Which assessment finding is consistent with fluid volume deficit? A. Bounding pulse. B. Jugular vein distension. C. Moist mucous membranes. D. Decreased skin turgor. Answer: D. Decreased skin turgor. This question assesses the nurse's ability to identify clinical manifestations of fluid imbalance, specifically dehydration or fluid volume deficit. Decreased skin turgor, characterized by skin that remains tented after being pinched, is a classic sign of dehydration due to reduced fluid in the interstitial spaces. For example, if you gently pinch the skin on a patient's forearm or sternum and it takes a long time to return to normal, it suggests a lack of fluid. Always remember that decreased skin turgor is a key indicator of dehydration, alongside dry mucous membranes and concentrated urine. Question 12. A nurse is preparing to administer an intramuscular, IM, injection to an adult patient. Which site is generally considered the safest for most IM injections in adults? A. Deltoid. B. Ventrogluteal. C. Dorsogluteal. D. Vastus lateralis. Answer: B. Ventrogluteal. This question focuses on safe medication administration, specifically identifying appropriate sites for IM injections. The ventrogluteal site is widely recognized as the safest and preferred site for most IM injections in adults because it is free of major nerves and blood vessels, and it has a thick muscle. Using this site minimizes the risk of injury, unlike the dorsogluteal site, which is close to the sciatic nerve. For instance, when administering antibiotics, the ventrogluteal site offers a large, well-defined muscle mass. Always prioritize patient safety by selecting the safest injection site, and for adults, the ventrogluteal is often the best choice. Question 13. A nurse is documenting a patient's intake and output, INO. Which fluid amount should be recorded as intake? A. Output from a urinary catheter. B. Vomit. C. Intravenous, 4. Fluids. D. Stool. Answer: C. Intravenous, 4. Fluids. This question tests the nurse's understanding of measuring and documenting fluid balance through intake and output. Intake refers to all fluids entering the body, which includes oral fluids, tube feedings, and intravenous fluids. For fluids directly contribute to the patient's fluid volume, making them a crucial part of intake documentation. For example, if a patient receives 1,000 milliliters of 4 normal saline, that entire amount is recorded as intake. Always remember that intake accounts for everything a patient consumes or receives as fluid, while output measures what leaves the body. Question 14. A nurse is providing care for a patient who is experiencing dysphagia. Which intervention is most appropriate to prevent aspiration? A. Encourage the patient to drink fluids quickly. B. Place the patient in a supine position during meals. C. Provide small, frequent meals with thickened liquids. D. Offer foods that require significant chewing. Answer: C. Provide small, frequent meals with thickened liquids. This question addresses the nursing care for patients with dysphagia, or difficulty swallowing, and aims to prevent a serious complication, aspiration. Thickened liquids move more slowly and are easier to control in the mouth and pharynx, reducing the risk of them entering the airway instead of the esophagus. Small, frequent meals also minimize fatigue and the amount of food processed at one time. For example, offering applesauce instead of plain water can help a patient with dysphagia swallow more safely. Always prioritize safety by modifying food and liquid consistency and positioning to reduce aspiration risk in patients with swallowing difficulties. Question 15. A nurse is preparing to transfer a patient from the bed to a chair. What is the most important initial action for the nurse to take? A. Lock the wheels of the bed and the chair. B. Obtain assistance from another staff member. C. Explain the procedure to the patient. D. Place a gait belt around the patient's waist. Answer: A. Lock the wheels of the bed and the chair. This question evaluates critical safety measures during patient transfers. The phrase "most important initial action" highlights a fundamental safety precaution. Locking the wheels of both the bed and the chair prevents movement, ensuring a stable base for the transfer and significantly reducing the risk of falls for both the patient and the nurse. For instance, if the wheels are not locked, the bed or chair could shift unexpectedly, causing the patient to lose balance. Always remember that ensuring stability by locking equipment wheels is a primary safety step before any patient transfer. Question 16. A nurse observes a red, non-blanchable area on a patient's sacrum. Which stage of pressure injury should the nurse document? A. Stage 1. B. Stage 2. C. Stage 3. D. Stage 4. Answer: A. Stage 1. This question tests the nurse's knowledge of pressure injury staging, a crucial aspect of skin integrity assessment. A Stage 1 pressure injury is characterized by intact skin with non-blanchable redness, meaning the redness does not turn white when pressed, indicating persistent localized damage. This stage is a warning sign that requires immediate intervention to prevent further tissue breakdown. For example, if a patient's heel shows a persistent red spot after lying in bed, it is a Stage 1 pressure injury. Always remember to assess skin carefully for non-blanchable redness as the first sign of pressure damage. Question 17. A nurse is administering a subcutaneous injection. At what angle should the nurse insert the needle for an average-sized adult? A. 15 degrees. B. 30 degrees. C. 45 degrees. D. 90 degrees. Answer: C. 45 degrees. This question assesses the nurse's knowledge of proper injection techniques, specifically for subcutaneous administration. For an average-sized adult, a subcutaneous injection is typically administered at a 45-degree angle to ensure the medication reaches the subcutaneous tissue layer without penetrating into the muscle. This angle helps prevent the needle from going too deep or being too shallow. For example, when giving insulin, inserting at 45 degrees helps deliver the medication effectively beneath the skin. Always remember that the angle of injection is critical to ensure the medication is delivered to the correct tissue layer. Question 18. A nurse is providing discharge instructions to a patient who will be self-administering insulin injections at home. Which instruction is most important to include? A. Store insulin in the freezer for long-term use. B. Reuse needles several times to save money. C. Rotate injection sites to prevent tissue damage. D. Inject insulin into the same spot each time for consistency. Answer: C. Rotate injection sites to prevent tissue damage. This question focuses on patient education for safe self-administration of medications, specifically insulin. The keyword "most important" highlights a crucial safety and efficacy practice. Rotating injection sites helps prevent lipohypertrophy, which is a lump that can form under the skin if insulin is injected repeatedly into the same spot, leading to unpredictable absorption of the medication. For example, teaching a patient to alternate between the abdomen, thighs, and upper arms ensures better absorption and healthier skin. Always emphasize site rotation to maintain skin integrity and consistent medication action. Question 19. A nurse is using the SBAR communication technique to report a change in a patient's condition to a healthcare provider. What does the A in SBAR stand for? A. Assessment. B. Action. C. Anticipation. D. Administration. Answer: A. Assessment. This question tests knowledge of the SBAR communication tool, a standardized method for effective communication in healthcare. SBAR stands for Situation, Background, Assessment, and Recommendation, designed to provide a clear, concise, and structured report. The assessment component involves the nurse's analysis of the patient's condition, including vital signs, current symptoms, and any changes observed. For example, when using SBAR, the A section would include the patient's blood pressure is 90/60 millimeter of mercury, and heart rate is 110 bpm, they are reporting dizziness. Always remember SBAR as a framework for structured and efficient communication, especially when reporting critical patient information. Question 20. A patient reports feeling anxious and restless. The nurse notes the patient's oxygen saturation is 88%. What is the most appropriate initial nursing intervention? A. Administer a sedative as prescribed. B. Recheck the oxygen saturation in 30 minutes. C. Raise the head of the bed and apply oxygen. D. Document the findings and notify the physician later. Answer: C. Raise the head of the bed and apply oxygen. This question presents a scenario requiring immediate intervention for a patient experiencing hypoxemia or low oxygen levels. The oxygen saturation of 88% is critically low, and the most appropriate initial nursing intervention focuses on addressing the immediate physiological need. Raising the head of the bed improves lung expansion, and applying supplemental oxygen directly increases the oxygen available for gas exchange. For instance, a patient with low SpO2 needs immediate oxygen support, as delaying could lead to further respiratory distress or organ damage. Always prioritize interventions that directly improve a patient's airway, breathing, and circulation. Question 21. A nurse is performing a focused assessment on a patient experiencing nausea and vomiting. Which question is most important for the nurse to ask? A. Do you have any family history of nausea? B. What did you eat today? C. When was your last bowel movement? D. Are you currently taking any herbal supplements? Answer B. What did you eat today? This question focuses on the assessment of gastrointestinal symptoms. When a patient reports nausea and vomiting, "What did you eat today?" is the most important question because it directly helps to identify potential triggers such as food poisoning, dietary indiscretion, or allergies. This information is crucial for pinpointing the cause and guiding further interventions. For example, if a patient ate seafood hours before symptoms started, it could indicate a foodborne illness. Always ask about recent intake when assessing gastrointestinal complaints, as it often provides vital clues to the underlying problem. Question 22. A nurse is preparing to administer medication to a patient. Which of the rights of medication administration is being violated if the nurse gives a medication ordered for patient A to patient B? A. Right patient. B. Right drug. C. Right dose. D. Right time. Answer A. Right patient. This question tests the fundamental rights of medication administration, which are critical safety checks. Giving a medication ordered for one patient to another directly violates the right patient, a primary safety measure to prevent harm. Ensuring the medication is given to the correct individual is paramount. For example, always use two patient identifiers, such as name and date of birth, before administering any medication. Always remember that verifying the right patient is the first and most crucial step in preventing medication errors. Question 23. A patient is receiving continuous enteral feedings. What is the most important nursing intervention to prevent aspiration? A. Keep the head of the bed elevated to at least 30 to 45 degrees. B. Check gastric residual volumes every 12 hours. C. Administer the feeding at a rapid rate. D. Dilute the formula with extra water. Answer A. Keep the head of the bed elevated to at least 30 to 45 degrees. This question addresses the critical safety intervention for patients receiving enteral feedings to prevent aspiration. The phrase, most important nursing intervention, points to the primary method to keep gastric contents from refluxing into the esophagus and airway. Elevating the head of the bed minimizes the risk of aspiration by promoting gravitational flow of the formula into the stomach and reducing reflux. For instance, if a patient is lying flat during feedings, the likelihood of formula entering the lungs increases significantly. Always maintain a semi-Fowler's to Fowler's position during and for at least 30 to 60 minutes after enteral feedings to safeguard against aspiration. Question 24. A nurse is teaching a client about the importance of hand hygiene. Which statement indicates the client understands the most effective way to remove germs? A. I should wash my hands with soap and water for at least 5 seconds. B. Hand sanitizer is always better than soap and water. C. I should wash my hands vigorously with soap and water for at least 20 seconds. D. A quick rinse under water is usually enough. Answer C. I should wash my hands vigorously with soap and water for at least 20 seconds. This question focuses on effective infection control through proper hand hygiene. The keyword most effective way emphasizes the correct technique for removing microorganisms. Washing hands vigorously with soap and water for at least 20 seconds is the gold standard for hand hygiene, as it physically removes transient microorganisms and disrupts the integrity of others. For example, singing the Happy Birthday song twice provides a good estimate for the 20-second duration. Always teach patients and practice yourself that a thorough, 20-second scrub with soap and water is essential for optimal germ removal. Question 25. A nurse is caring for a client who has a living will. The client's family is requesting all possible life-sustaining treatments. What is the nurse's primary ethical responsibility in this situation? A. Encourage the family to pursue all treatments. B. Honor the client's wishes as expressed in the living will. C. Convene an ethics committee immediately without consulting the family. D. Follow the family's wishes as they are the next of kin. Answer: B. Honor the client's wishes as expressed in the living will. This question addresses a critical ethical dilemma concerning patient autonomy and end-of-life care. The keyword primary ethical responsibility points to the nurse's duty to uphold the patient's previously expressed wishes. A living will is a legal document that articulates a patient's desires regarding medical treatment, and the nurse must advocate for these wishes, even if they conflict with the family's desires. For example, if a living will states no artificial ventilation, the nurse ensures that this directive is followed, working with the medical team and explaining the will's intent to the family. Always prioritize patient autonomy and respect advance directives as legal and ethical mandates.